What is ELLKAY Bridge? To understand ELLKAY Bridge completely, it would be best to peek inside a clinic's workflow and see exactly how it works. This is Bob. He needs to visit his doctor today for his yearly checkup. Let's follow Bob on his visit. At the front desk, Bob shows that he has new insurance and hands the card to the staff. The staff verifies his record and adds his insurance information into the PM system, makes a copy of his insurance card, and adds it to the patient chart. The physician now examines Bob. Asks the nurse to order a blood test and takes a sample. The assisting nurse will fill out the requisition, starting with patient information, insurance information, and test and specimen details, copying all the information manually. Now let's compare the workflow if the clinic was using ELLKAY Bridge. Instead of handwriting all the patient details manually from the patient chart, the nurse will simply select the Bridge It button, look up the patient using Smart Search, and with one click, all the patient demographic and insurance information is seamlessly bridged over to the laboratory ordering system in less than 3 seconds. The nurse selects the test and hits enter to complete the order. With ELLKAY Bridge, practices never have to retype patient demographic and insurance information that already exists in their PM system, saving them time, reducing inaccuracies, and providing a better user experience. Bob is done for now. The clinic will follow up with him once the results are back. Now we go to the laboratory and see how they process Bob's order. The lab receives Bob's specimen, along with the requisition. The sample is processed, and the claim gets submitted to the insurance company. But this is where it gets complicated. Claims that are submitted using requisitions that are manually filled out are not always clean. They could be inaccurate or have missing information. And that's what happens in Bob's case. The claim gets submitted to the insurance company and is rejected on the first attempt. The lab staff goes around in circles, on one hand trying to communicate with the busy clinic to verify the insurance information, and on the other hand calling the insurance company to find out the reason for the rejection. Not knowing the cause of the rejection, the billing department sends Bob the invoice, hoping for him to pay. Bob is now confused and furious as to why he has to pay the laboratory bill when it should be covered by the insurance company. After going back and forth a few times, eventually the lab staff finds out that the assisting nurse used the old insurance information from the chart. The clinic office staff relays the correct data over the phone to the laboratory billing company, who then resubmits the claim to the correct insurance company and hopes the new claim will go through. Illegible data and incomplete orders lead to loss in revenue for the lab. When a laboratory receives orders that are created using ELLKAY Bridge, the data is more accurate as it is taken directly from the PM system. Accurate data in laboratory orders reduces billing errors and ensures that claims submitted to insurance companies get processed immediately. Not only does this reduce claims processing time, but this also leads to faster payments. For more than 10 years, ELLKAY Bridge has provided vendor-agnostic connectivity to 450 different systems across 900 different versions of these systems. ELLKAY Bridge saves time, reduces inaccuracies, and produces clean orders for laboratories, while practices benefit by changing their focus to providing better patient care. For more information or to schedule a demo, contact ELLKAY at 201-791-0606 or visit our website at www.ellkay.com.
How do you handle your orders and results interfaces? Implementing and managing multiple interfaces between different systems can get complicated, time-consuming, and expensive. VPNs are a costly hassle. Custom software solutions have limited scalability, HL7 formats need mapping, and a lot of interfaces require a lot of maintenance. What if there was a cost-efficient and easy way to create your interfaces, manage them, and track all your electronic orders and results? With ELLKAY Transfer, there is an easy-to-use, powerful tool that makes connectivity adoption between laboratories and EMRs effortless, keeping you in control, keeping all of your interfacing simple, secure, and HIPAA compliant. Platform-independent ELLKAY Transfer works with any operating system, any EMR interface and HL7 format without any VPN connections. Right out of the box, it supports all methods of pickup and delivery, and its single-point connectivity feature eliminates separate connections to individual practices, opening doors to all practices with one connection. Intelligent tools like HL7 Converter and Insurance Mapper are built into ELLKAY Transfer for ease and accuracy, ensuring all deliveries are in the desired HL7 format and with appropriate insurance information, no matter what systems your clients are using. All this from a centralized web-based dashboard. Log in from anywhere and create new accounts in seconds. Configure interfaces and make changes to these configurations remotely. Control days, times, and frequencies for individual practices' transactions, even while you're away from the office. View all your interfaces and a live snapshot of activities, right when they happen. Transaction summaries, pending transactions, recalls, as well as errors. Drill down into any transaction and view the details of a specific file or part of any message. Search for all weekend transactions or a specific insurance code within an HL7 message. And when needed, you can also start, stop, or pause your interfaces without ever contacting the physician's office. And most importantly, live alerts monitor all your interfaces, so you never have to stay up worrying if transfers are stuck or taking too long, if the system's down or working sporadically, if activity is out of control, or if all units are checked in and accounted for. Knowing your interfaces are safe, now you can send and receive hundreds of transactions in minutes. When attention is needed, an email or text notifies you immediately, so you can sleep at night, worry-free. With such a powerful and easy-to-use tool, you will never think of your interfaces the same way. Whether you're a small or large lab, looking to build interfaces yourself, or have a dedicated, experienced team build them for you, ELLKAY Transfer is a proven solution, giving you full control for all your interfacing needs. To learn more about ELLKAY Transfer and its additional features, contact us today or schedule a demo at 201-791-0606. Or visit our website at www.ellkay.com.
Praku, the only product designed to close the loop in the referral care cycle. Did you know that 50% of referrals never make it to the specialist's office? Okay, so let's look at the current referral process. Referring physicians scribble specialist names on a piece of paper and hand it to their patients. Then, it's the patient's responsibility to schedule the consultation. Some patients do, but others are either too overwhelmed to make the call, forget, or procrastinate until it's too late. And because these physicians aren't connected, the referring physician has no idea if their patient made the appointment. And specialists have no idea that a new patient was even referred to them. A completely disconnected and broken system that leaves many patients untreated. Now let's take a closer look at this problem and how Praku fixes it. Meet John, a busy dad, who started feeling a little weak and short of breath. He went to see his family physician, Dr. Gray, who ran some blood tests and saw that his red blood cell count was low. To help evaluate his anemia, she wrote the names of 3 GI specialists on a piece of paper and told John to call for an appointment. John had every intention of calling, but he got busy at work and the symptoms were no longer noticeable, so he never made the call. Well, 3 months later, the weakness came back, and John called Dr. Gray again. Furious and frustrated at her patients not following through to see specialists, Dr. Gray now wanted a solution and decided to sign up for Praku. She can now send referrals directly to specialists and track her patients' progress through the care cycle. So this time, instead of asking John to call for an appointment, Dr. Gray used Praku to facilitate the referral. In seconds, John's information was sent electronically to a trusted GI specialist, who immediately received the Praku notification, along with John's insurance information and the reason for the referral. The GI practice staff called John that same day to schedule an appointment. This scheduling was monitored by Dr. Gray on her Praku dashboard, and she immediately felt a sense of relief knowing John was in good hands. The GI specialist performed a colonoscopy, found that a cancerous growth in John's colon was causing his weakness, and sent these concerning results back to Dr. Gray in seconds with Praku. Without wasting time, Dr. Gray used Praku again to send John's new clinical information to the most suited colorectal surgeon. John, already troubled with this new information, was pleasantly surprised to receive a call from the colorectal surgeon's office to schedule a consultation. He couldn't believe the VIP treatment he was receiving. Soon, John had a successful surgery to remove his tumor, and the results were communicated to Dr. Gray through Praku. It was perfect. All physicians were kept in the loop. John was free of cancer, having received the prompt care. All thanks to Praku. So, what are you actually getting when you connect with Praku? A well-designed, cloud-based, secure, and HIPAA-compliant communication platform connecting all physicians regardless of the EMR they're using. Its intuitive design with easy-to-use dashboard views allow offices to view the full life cycle of patient care, track and follow patients, know when referrals are received, accepted, and scheduled, send and receive any paperwork, including lab results, making referrals super easy and super efficient for any practice. Our goal is simple: to close the loop in the care cycle and to facilitate physician-to-physician communication so you can focus on patients, patient care, and growing your practice. Now that we know all about Praku, it's time for you to get your own practice connected. It only takes minutes, really just minutes, to sign up and get started.
Practices and institutions like yours are constantly evaluating the EMR marketplace, and you could spend months researching, selecting, and implementing a system that meets your unique requirements. Once a new EMR is selected, the challenge becomes how to keep legacy data accessible in order to comply with state and federal regulations, and more importantly, how to continue providing physicians access to their patients' legacy data to maintain continuity of care. Though physicians can continue using legacy systems to access historical patient data, maintaining these legacy systems is inefficient and expensive. The annual maintenance and support alone for the old systems significantly increases your IT costs. ELLKAY EMR Archive allows you to discontinue your old EMR and retain your legacy data alongside your new EMR permanently. It's a simple, HIPAA-compliant, web-based application that provides easy access to your legacy patient charts anywhere, anytime, giving you the freedom to switch EMRs quickly and cost-effectively. It doesn't matter which EMR you're leaving. ELLKAY's data extraction and conversion team has over a decade of experience with hundreds of EMR systems. Here's how it works. ELLKAY's dedicated project managers evaluate and extract all your legacy system data, such as demographics, appointments, medications, allergies, immunizations, lab results, vitals, plus scanned items, images, PDFs, and any other clinical information you need from your legacy EMR. Based on your preference and our technical analysis, data is stored in discrete, searchable modules that are organized by patient chart. Access ELLKAY EMR Archive via any web browser or launch it directly from your EMR to seamlessly access your legacy patient data. Search for patient records, view, export, and print. Data is accessible from multiple logins at multiple locations for collaborative, coordinated care across your organization. It doesn't matter if you're a large health system acquiring and consolidating ambulatory practices that use disparate EMR systems, an EMR vendor looking for a conversion and archiving partner, or a small practice in need of an archiving solution. ELLKAY EMR Archive makes EMR migration easy and legacy clinical data accessible for all types of organizations, anywhere, anytime. For more information about ELLKAY EMR Archive and the other ways ELLKAY is making interoperability happen, call 201-791-0606 or visit our website at www.ellkay.com.